Actually, I've just got a message that Mr. Christoph is going to be late since he's in another commission. Dear guests, can we count the quorum? We've got 16 members of the Healthcare Commission. We've got 16 out of 20, so I open the regular meeting of the Healthcare Committee. We have one point on the agenda, and it is discussion, healthcare after the pandemic, policies, investments, technologies, human capital. And it's going to be with the kind participation of Mr. Joran Jute from the European Commission. Dear colleagues, do you have any suggestions for the agenda? No suggestions? Let us vote. 16 for. So let us open our meeting. Dear colleagues, I would like to inform you that the discussion today is on the basis of a letter with a registration number, a long number, from the 11th of January this year from Dr. Ivan Vetsev, who is the chair of the National Patients Organization. This letter is about having a discussion on healthcare after the pandemic with the special participation of Mr. Jute, who is the head of the General Directorate at the European Commission. I would like to thank Mr. Jute for attending our meeting in spite of his busy schedule. We appreciate his presence. The COVID-19 pandemic actually put under pressure all the healthcare systems in the European Union. The timely healthcare service provision has been a problem. So it is very important to guarantee quality of access of patients throughout the European Union. In Bulgaria, the crisis was a multi-level one and demonstrated a number of problems that we are accustomed to, and it showed the deficiencies in our healthcare systems. We know the positive and negative sides of our healthcare system. Most of us work in it, and most of the reasons for the bad consequences of the pandemic are clear. However, we have to find positive solutions to turn the tendencies for the better and to improve the health of the nation in the long term and short term. And we hope our healthcare system has the Bulgarian citizen in focus. Healthcare is an investment in the nation and is very important for the economic prosperity of each country. There could be no prosperity without accessible healthcare services. These are the basic principles that lead the World Health Organization, the European Commission, and the member states of the European Union when forming policies in this field. How can we make our system modern and oriented towards the citizens so that we provide good quality healthcare? This is the role of us, the representatives of the institutions and other organizations, as well as the civil sector with its expertise. This should be the approach that should lead us in our future work. It's time to act. All these characteristics of our healthcare have been included in the State of Health in the EU report, and for Bulgaria, there are challenges, including investments for setting up a unified healthcare system. On the background of this and answering the crisis, the European Commission suggested practical instruments to help the member states to use public investments for reforms to reduce the effect of the pandemic. and at the same time to contribute to the long-term sustainability. This is the mechanism for resilience and recovery. Bulgaria is facing a challenge, how to use these instruments and how to provide its citizens the instruments for overcoming the consequences of the crisis. The collaboration with the European Commission is not only targeted at financial support, but for using good practices, established practices in the healthcare that can be adapted and adopted in the healthcare system of Bulgaria. This is the reason why Mr. Joran Jute is part of our discussion today, to speak frankly about these issues, focusing on what can we improve from today on. Political talking sometimes is stronger than real action, and is the main reason for disappointment of citizens and those working in the system. One of the demonstrations of the political will to prioritize the healthcare services is the adequate budget in the sector. Analyzing the priorities of the Bulgarian government, we can notice that the budget for 2022, there is an increase of up to 5.8% of the GDP. Previously, it was 4.8%. We are trying to reach the 8% that is prevailing in the other member states. It is true that in this increase, there are included measures, anti-COVID measures, that are going to be finished, but this time should be used by all of us for real support of the medical specialists. Everything depends on us, the politicians, as well as the leadership of the medical organizations. Another important thing besides the budget is providing the environment for its logical use, improving the healthcare system. That is why such a debate is important, and that is why we are organizing this event. Another issue for us is how to keep the young doctors in the system, young medical specialists in the healthcare system. Our policies should be targeting better conditions, labor conditions, better salaries, and better opportunities for career development of the medical specialists in Bulgaria. I hope the discussion today shall help us to find the right solutions in favor of the Bulgarian citizens and of the Bulgarian healthcare system. And this is the end of my short introductory speech, and I give the floor to Dr. Ivan Vetsev to present the initiative today. You have the floor.
Hello, everybody. In the first place, thank you for the opportunity of the National Patient Organization to be part of the Commission today. Associate Professor Moviv clearly identified the main priorities related to the issues in healthcare and the necessity for multi-sector approach. What I would like to add is that healthcare should not be only a priority of institutions, only for patients, but also for the society at large. Because the COVID crisis that we are all witnessing over the last 2 years has shown us the multi-layer problems in the system. They are clearly outlined in the report. The high percentage of payments from patients, the low percentage of health-insured citizens in the Republic of Bulgaria, the unequal access to healthcare in certain regions of the country, there are deficit of medical professionals. All this causes some inequality in this system for access to healthcare. And the objective for Bulgaria and all European citizens is to have equal and timely access to the healthcare systems to enjoy quality healthcare. And I believe the report we're going to hear is not too critical. And I suggest we look at it as a positive one rather than a negative one, because we're all aware of the issues. They can always be reversed. So I believe we as a patient organization could contribute actively along those lines as we have done over the years. Thank you for your attention. Thank you, Dr. Vetsev. After these words of introduction, please let me give the floor to Mr. Yuran Yute.
Now I give the floor to Mr. Yute, and he's going to be translated simultaneously.
Okay. Thank you so much for this introduction and for your kind invitation. So, Your Excellencies, distinguished members of Parliament, and all other distinguished representatives of stakeholders, I'm very grateful to be here with you today because it's a very important moment. We are in a period where policies, reforms for the coming years are defined, investments for the coming years are defined. So my name is Jeroen Jutte. I'm the head of unit in the Employment, Social Affairs and Inclusion DG of the European Commission. And in that context, in particular, responsible for Bulgaria, Romania, for the European Social Fund, for the European Fund for the Most Deprived. And importantly, in the context of today's discussion, I also play with my team a central role in the European economic and social governance system. We prepare analysis on employment and social issues, education, and in particular also healthcare, together with other Commission services. And I know a dear colleague of mine from DG Santé has spoken a few months ago in your gathering. And this feeds into country reports that are written on each member state on economic and social issues, and also in the Commission proposals for country-specific recommendations. And these go to Council, and ultimately they are endorsed in the European Council, so at the highest political level, and thereby also by the Bulgarian government. And these recommendations steer how we believe member states should move forward on reforms and should steer the use of European funding. It is this analysis, this fact-based policy approach, on which I will focus today. So the look from Brussels at the healthcare system in Bulgaria, looking beyond the current crisis. And as I said, the time for doing so could not be better. There's a new government in place. Important funding programs are being negotiated, representing many billions of euros for the coming years. Euros that should go into the right policy mix, that should go into investments for Bulgaria's future, and thereby also investments in Europe's future. And out of this funding, an important part should and will go also to the healthcare sector, improving healthcare. I will concentrate on three main elements in my intervention. And I will leave aside many important dimensions, nuances, and actions because time is too short and it will allow me to have some focus. Firstly, what are the main socio-economic developments that we should consider for the healthcare sector more broadly? Secondly, how is the healthcare system doing today? And where do we see the main problems? I heard already a few. And thirdly, what are the broad outlines for making progress? And hence, what do we believe should be priorities for the funding and the reforms? So let me start with the broad context. Well, the recent census, the 2021 census, we just saw the new data, shows that the population in Bulgaria experienced an important decline over the last 10 years. And this trend will continue, there's no doubt. Our growth projections suggest that the Bulgarian working age population, so 20 to 64, will decrease by close to 500,000 people. That's about 12% of your working age population. And this decline will have a huge impact. I heard mentioning that today some 200,000 job openings could be filled if employers could find the right people. And last October, a business survey reported that's about 71%, more than 2/3 of all companies, have difficulty filling open positions, finding a suitable workforce. And a part of the explanation is this shrinking working age population. Now, with unemployment low and female employment rates relatively high, this will only get worse in the years to come. It implies that staff and skill shortages will hamper companies to develop and grow, and it will also make providing public services more and more difficult. So what to do? Obviously, one needs to look at how one can increase the labor supply, and in particular also the quality of labor supply. How can we be more productive? One must invest in training, in long-term care, childcare, and activation measures for inactive groups. But that is not enough. We must also, a part of the answer lies also in what we do in the domain of healthcare. Healthcare is not only key for our well-being, as you very well know. It is not only a moral issue or an ethical one. It is a vital element for a strategic policy setting, sustainable progress, economic growth, and social advancement. If there would be fewer people home with an illness of some kind, and if citizens would have more healthy years, the labor supply would benefit. Business would benefit. We all would benefit. So what do we see from Brussels considering these trends? So what is the state of play as we see it? I take first one step back. The European Pillar of Social Rights sets out 20 rights and principles that represent the compass for European social policy. And the pillar has been endorsed at the highest level by the European Council and also by the European Parliament. And if you do not know it, I invite you to read it. It's very short, and I'll give you immediately an example. Importantly, Pillar Principle 16 concerns healthcare. It reads as follows. Everyone has the right to timely access to affordable, preventive and curative care of good quality. That's it. And it's very clear. And I think we can all sign up to this ambition. Short, to the point, clear, and also an economic necessity beyond a moral and ethical one. And on that basis, I would like to dissect what we see at the moment in Bulgaria. Let me start with an overall outcome indicator which covers more than healthcare alone. Life expectancy. Bulgaria has, with 73.6 years, the lowest average life expectancy in the European Union. And here I did not include the impact of the COVID crisis, which in fact put Bulgaria further back relative to the other countries. Preventable mortality is over 40% higher than the EU average. In other words, more effective healthcare policy could and would save many lives. Bulgaria has, for treatable causes, the third highest mortality rate in the EU. In other words, many people do not get the treatments that are as such readily available. Often this can concern something as basic as high blood pressure, leading to strokes and heart attacks. These are major causes of death in Bulgaria. What these three elements combined tell us is that we do not do enough on prevention and easy access to healthcare. And notably, easy access to primary and outpatient care. Many do not take often basic yet vital medication. In short, improvements can be made on the following actions. Preventive policies, more effective preventive policies that support healthy lifestyles, notably in the more marginalized, the poorer groups of society. Access to basic primary and outpatient care is insufficient. It would make a huge difference if the barriers could be reduced, starting with having places to go to. Progressing on these elements can help identify early on health issues that can be treated, reducing costs by avoiding often later more invasive and more expensive treatments. This is of course not the full picture. Even if we would do more preventive care and have more primary and outpatient care posts, other blocking factors also limit in practice access to healthcare in one way or another. And let me look at a few. Bulgarians are faced with the highest level of out-of-pocket payments in the EU for medication and health services. The main drivers of this is that many services and medicines are not covered by the benefit package, or there is a cost sharing for them. In short, we should consider a reassessment of what is covered in your insurance system and how broader coverage could progressively, over time, be financed. This is important. And it also links to another issue, informal payments. The out-of-pocket payments and the informal payments, so payments that normally speaking would not take place, the under-the-table payments. These two factors combined make that people delay care or even avoid it altogether. And this impacts the number of years one can live healthy and productively in particular, and happily I would say, and thereby also of course life expectancy. Another point is that many Bulgarians do not have health insurance. The Ministry of Finance estimates some 10% of the population, and other estimates suggest this figure could be close to 1 million. This uninsured group overlaps considerably with your inactive population and marginalized groups, the part you will be so dependent on for future growth. This is where you have the potential for getting more people into employment and jobs. Jobs that employers now have such a hard time finding workers for. Third element. International experts consider that Bulgaria's health system is excessively centered on hospital care. Excessively centered on hospital care. Those are the words. It has many hospital admissions for treatments or conditions that could be managed effectively in outpatient care. Outpatient care is much cheaper. Also, people stay relatively long in hospital, and much of this has to do with insurance issues. How do you organize referrals to hospital specialists, or can they be jumped just like that? How do you reimburse and finance hospital care? Clearly, the system does not work to create, in this sense, a better cost-benefit ratio. And this has a high cost on the macro level. Hospital care represents some 40% of your spending on healthcare. In relative terms, that's about 1/3 higher on average than other member states. So shifting focus to prevention and outpatient treatment is a good idea. It's much cheaper, it has lower barriers for people to make use of it, and is often better in terms of outcomes because it intervenes earlier. In short, a relative shift would help the cost-benefit ratio, liberating resources that can be invested in higher quality care, in better outcomes. Now, all this list is still not sufficient. I'm sorry. But there are more points to be made. For better health outcomes, we need to look at the final list that I've made. Critical issues. Critical issues. Bulgaria has approximately 4.4 nurses per 1,000 population. And I can tell you, this is extremely low figure. In our assessment, several factors contribute to this nursing shortage, including the low number of nursing graduates and the loss of trained nurses, of course, due to immigration. It's a fact of life at the moment. And also dissatisfaction with salaries and working conditions does not help. Last year, you know very well, nurses organized protests across the country. And an added risk, a high added risk, is that it is an aging workforce. The average age of nurses is over 50. So in short, you will soon have to replace many nurses with new ones, but you're not training them in sufficient numbers to do so, let alone making up for the gap. We note that indeed some action has been taken and interesting proposals are on the table, and this is of course good. And we believe this issue, this shortage issue, is an essential element for future action, for further action. No nurses, male or female, means no healthcare. And healthcare workers are really the heart of an effective care system. In short, we need to consider the education system and whether its capacity is used, and if used efficiently, and maybe need to increase that capacity or adapt it in other ways. The organization of work in the nursing profession. Should all health workers have the same qualifications for doing certain tasks? Can we rethink distribution of tasks to make it more effective and to use the ones with higher skills levels only for the more complicated elements? The salary levels, of course, notably, but not only those working in less attractive locations. And we are, of course, in that field aware of interesting proposals. The insurance system implications, for example, to what extent can private entity nursing services be reimbursed by the health services? But there are other elements as well. And there are more points that could be added to this list. Clearly, the impact of all these measures combined should be compared to the needs, the demographic trends today and over the coming years. But one thing is certain, not addressing the shortage will lead to enormous problems and avoidable suffering. And please allow me to take a small, between brackets, moment here to salute the nurses and more generally the full medical profession for their efforts and resilience in this long-lasting crisis. We all hope, of course, that things will get better soon and vaccination rates go up, in particular in Bulgaria. But clearly, in Bulgaria and throughout Europe, citizens should be grateful, and the European Commission is grateful for all the efforts made in these hard times by the healthcare workers. Linked to many issues I named is the geographical distribution over the country of health services and health specialists. Poor areas, rural areas, suffer from an important lack of services. They have simply less access, contributing to inequality and worse health outcomes. Also in this domain, policy developments are in the pipeline, which we welcome. And as a last point, we believe e-health can help. One can imagine having a local small health center in a rural area with only nursing staff. They can do basic investigations, blood pressure, simple blood test, maybe a radio picture. And then much like I speak here today with you, a consultation can place with a doctor online. It's not ideal, but it's better than not having any doctor consultation. This, of course, requires having the medical center, the nurse, the IT, and also, of course, a doctor that gets paid for his time. At present, your insurance system, as I understand it, does not reimburse such service from a doctor. I will come to my conclusion. I started by saying opportunities for progress lay before you, and they do. Over the coming years, more than 17 billion euro of investment funding from the European Social Fund, Regional Development Fund, Just Transition Fund, Cohesion Fund, and the Recovery and Resilience Facility are available to be supported by accompanying reform. This is a huge budget. This is a great sign of European solidarity and also a great responsibility for the new government to use it well for your nation and for future generations. And you all here today play a vital role in making this happen. The enormous budget will support making progress in the healthcare domain. In our engagement with the national authorities over the last months, on the challenges we have seen and that I've outlined, we see an increasing appreciation of the issues we have identified. Indeed, they were earlier already part of country-specific recommendations made by the Council to Bulgaria. And Bulgaria has taken important steps in the right direction with measures currently envisaged. So my conclusion, my outlook, is positive. What matters now is to finalize the talks on the programs, establish the firm commitments in a final agreement on the Recovery and Resilience Program, and move step by step forward, implementing on those commitments, reaching targets, fulfilling agreed milestones. On all these issues, and many others, the Commission stands ready to support Bulgaria in achieving better outcomes. The time is right. The promise for substantial progress is real. We know what we have to do, impacting positively the life of many millions. Thank you for your attention.
Would like to thank Mr. Jute and as we all heard, our reality has been scrutinized, and European Commission is aware of most of the issues that we are looking solution to. What we can be useful to each other is adopt and adapt ready practices. There are programs and funding through which these practices can be better received by our healthcare system. Let me give the floor to the Minister of Health, Professor Sena Serebezova, on the topic. Professor Serebezova, dear Chair, dear ladies and gentlemen, members of Parliament, I had the impression that the discussion of today, healthcare after the pandemic policies, investment, human capital, it turned out to be a review by the European Commission of the State of Health results. Of course, no doubt they're related, but part of the issues that were considered were a result of processes that have been around for a long time in our healthcare system, for tens of years. So looking at the reaction of members of Parliament, I believe they reflect their opinion too. I'm reflecting their opinion too. What I can present to you on the general framework of the topic, what is going on with the pandemic, what we expect to happen and how we are doing. Let me say what I have prepared in advance, and also I will say something ahead of the recommendations that Mr. Jute mentioned, because today, you know, we had a presentation of the budget of the National Health Insurance Fund, and some of the recommendations we heard from Mr. Jute are already envisaged in the budget, which I will demonstrate in a while. In the first place, I would like to thank the Healthcare Commission for putting forward this important discussion today. It is important, although that was not the accent of that report, because COVID-19, sooner or later, just like any crisis, will be over. From our activities, it depends how earlier it will happen. It's clear. It's important to be clear about the necessity for actions to contribute to sustainable stabilization of the healthcare system of all member states, whose capacity undoubtedly boast of all countries without exception, depending on national particularities, budgets, and other factors. But no doubt each member state was faced a serious challenges on a large scale. Definitely, in public health care, emphasis should be put on the prepared readiness of member states, of the European Union itself, on transborder threats such as COVID-19 and taking care of public health. Important to fight this pandemic is the necessity for provision of supplies of medications, including vaccines, on a EU level, because we are not alone. It is key that the regulatory framework of European Union to guarantee that in the heart of medicine policy will be the patient, and the decisions for launch on the market will be based on the solid clinical evidence in compliance with requirements for quality, efficacy, and safety of medications. In the context, through the prism of prioritizing interests of patients, because this undoubtedly was mentioned several times and is a priority, we have to develop support for the R&D industry in the EU, along with investment by the Union in R&D infrastructure. We should take into account all complex factors, including equal geographical distribution of production facilities. EU is investing. Equal geographic distribution is not an issue for certain countries, but also for the European Union in a bit different context from what was commented. Also, the prices of and costs for medical education. This is how equal access will be guaranteed to new and available medical therapies, because no doubt Bulgarian citizens also, just like all other citizens of the European Union, are entitled to fast access to such products. Also, I would like to mention that the COVID-19 pandemic created an unprecedented cooperation within the EU beyond the traditional, until then, framework of actions. Transborder of this crisis encouraged looking for solution at EU level, with coordination at all levels, with very short deadlines to make decisions with consensus at EU level. At the same time, the lessons learned confirmed that the analysis at national level in the future will remain a factor to make decisions by member states in the field of healthcare. Last but not least, human resources in the field of public health are not unlimited. They are extremely valuable, and their expertise should be used adequately. The intensive coordination at EU level in the context of combating COVID-19, including the large number of additional working formats, proved that it's important to be clear about distribution of functions and activities without overlapping. In this way, we will manage correctly the processes and avoid the administrative burden. This approach will guarantee the fully-fledged access, as you mentioned, countries such as Bulgaria, with more limited human resources for a number of reasons. Organizing and coordinating follow-up activities and initiatives at EU level have to take place after certain analysis, impact analysis, and taking into account the possibilities and capacity of the smaller countries, EU members. With regard to what you commented on and the importance of prevention, prophylaxis, screening, and emphasis on outpatient care, this has already been provided for. We're looking into the future. It's on the budget, as well as National Healthcare Insurance Fund. With regard to outpatient and inpatient areas, we have funding of health activities, package 2, paragraph 1. This is healthcare services in the homes by midwives and nurses or assistants. This is the patronage care. In specialized outpatient care, we have additional 800,000 for physiotherapy, rehabilitation, almost 8 million. We have funds to provide for prophylaxis outside outpatient, to monitor diseases, so to compensate for the measures related to the epidemical situation with regard to visiting medical professionals, etc. So the funds are 380,229,000 leva. Also, we have additional funds for new medical diagnostic studies in clinical laboratories, and in the draft law we have a lot more funds, 207,086,000 leva. On the average, the increase in the funds to be invested, because I would say invested, they are not costs, but investment in specialized outpatient care, including for complex patient observation and care, is 33.3%. Thank you for your attention.
Thank you, Professor Serbezova. Thank you, Professor Serbezova. The information that you provided shall be used by us, and we will see what happens after the budget 2022 is approved by the Parliament. Now I would like to introduce Mr. Ivan Krastev, who was a bit late. He's Deputy Minister of Health, Social Policies, Labor and Social Policies. Dear everyone, please excuse me for my being late because I was part of another commission in the Parliament. I would like to add to what Professor Serbezova already said. The investment in human resources in the healthcare area, providing investments for outpatient care and access to medical care in distant regions is a priority not only of the Ministry of Health, but of the whole Bulgarian state and of the Ministry of Labor and Social Policies. We are also working towards providing access to medical and social services, or social and health, as you wish, as you may call them, for a large number of the Bulgarian population, especially disabled people, people who are old age and live in distant areas. I can only approve of what Mr. Jutta said. In the next 7 years, we are going to have more than 3 billion leva from the European Social Fund. As you know, the European Social Fund and ESF Plus is the instrument of the European Union which is being managed most efficiently with the best financial and technical results. In the very beginning of the implementation of these programs in 2007, we've been introducing measures in the field of healthcare and social services, IT, expertise, patronage, and including the initial measures that were support measures for the first-line medical persons, the so-called 1,000 leva. They were financed by European funds through the Ministry of Labor and Social Policies. This is what we've done so far, but now I would like to focus your attention on what lies ahead. We're envisaging a wide range of measures and actions in the field of healthcare. I'm not enumerating them by priority, because if I start by priority, our priority is providing specialists, health specialists, because in the last decade, the specialization of young doctors is also being financed by the European Social Fund with the cooperation of the Ministry of Labor and Social Policies. The first priority in the field of healthcare is a balanced distribution of medical specialists in the different regions of the country. So we have support for centers, medical centers in distant regions, and this is also financial support for hiring both doctors and other medical staff in such small places. Opening health centers in difficult to access regions and support for specialized medical care. Internal gynecologists and other specialists. The lack of pediatric care, not only in the distant regions, but also for marginalized communities, is a high risk for children. Dear ladies and gentlemen, I believe this should be a national priority. And alongside the social support and the different financial support provided by the state, we should guarantee each child access to high-quality health care, not from the time of its birth, but from the time the mother knows she's pregnant. The next thing is support for human resource. Financing specialization of doctors is an important issue. This is an urgent, this is a very successful project with very sustainable results. The prevailing part of the doctors who specialize, financed by this program, stay in the country and find their nice professional realization. So we're going to support both doctors and dentists, as well as nurses. The short-term specializations, the short-term trainings are priority in our policy. Increasing and improving the qualification of the health specialists is really important. We are targeting a very wide range of specialists working in healthcare because this has proven to be the main challenge. Because when we see the shortage, when we analyze the shortage of medical professionals, there is a great demand for such. In the beginning, it was nurses only, demand for nurses. But recently, it is demand for doctors too. And the shortage is present and clearly felt. It has regional dimensions. However, if we don't take measures, this problem will worsen. And I believe that together with the Ministry of Health, as well as the Ministry of Education and Science, we will try to find and will find a solution. And last but not least, the measures targeting prevention of socially dangerous diseases. We have been having projects targeting social measures, providing access to social services to some marginalized groups. Now, this is a new separate priority because we believe the access to healthcare, quality healthcare at each stage of a person's life is extremely important for the integration of each and every individual. And from the point of view of his or her professional development too. And I am available to question. Thank you for your attention. Thank you, Mr. Krastev. This is the end of the presentations as planned within the agenda. As part of the agenda, I would like to open a discussion, and I suggest the questions to be one question per person. And if somebody has more than one question, he should direct it to the different participants, to the different presenters. I would like to make a short comment. We all know that the system for supporting healthcare and the system for social care are interconnected vessels, because one system gives human resource to the other system and vice versa. And this is the way the healthcare system has both financial and professional availability. So there is a very good connection between the two systems, the social and the healthcare one. They should grow together and develop together. I would like to make a recommendation to Mr. Kristof. Part of the instruments that you mentioned, and they're very good instruments, and they provide opportunity for development of young specialists. However, the support is not enough. These instruments would give much better results if there is a good information campaign at the universities, in the universities where the graduating students should be made aware of the measures that are available for their further professional development. Our party in the parliament, I'm the chair of the Health Commission at the parliament, and one of the priorities we're going to work on, together with a team of Minister Serbezova, we are going to provide motivation for young specialists to choose Bulgaria and Bulgarian healthcare system as their environment for professional development. The good financial results are responsible for 35% of the motivation. If we make the salaries twice as big, this will not immediately solve all our problems, but we can do it in a different way too. Thank you, Mr. Ute, for being part of our work, of the work of our commission. If you have questions, dear Mr. Ute, dear Minister, dear colleagues, I would like to focus your attention, that is in the context of the topic. And this is healthcare out of the COVID-19 pandemic. Unfortunately, in the last 2 years, the other diseases of Bulgarian citizens have been neglected, seriously neglected. Planned operations have been stopped. There are problems with people on hemodialysis. We get a lot of signals. Prophylaxis is being underestimated. Chronic diseases are not treated the way they should be treated, and this is due to the anti-COVID measures. And we have to discuss these problems, and we have to start activities. The pandemic will be over, but the moment it's over, we will see how bad the health of the Bulgarian people is regarding other diseases. For 2 years now, the Bulgarian people, besides being poor and ill, they are so poor, the poorest in the European Union, and the Bulgarian people have been put under distress. This distress leads to social isolation. People are deprived of the opportunity to study. Students develop neurosis and psychosis, and there is no state strategy how to overcome this. Maybe Minister Serbezova is going to give an answer whether there is a study about children, how children have been affected by the COVID measures. You know that in this very young age, they need social communication, they need security. And I would recommend to put an effort, all of us, together and pay attention to healthcare services besides or beyond the epidemic.
Dear Chair, dear ladies and gentlemen, members of Parliament, dear Mrs. Lucheva, the issues you raised are no doubt very important. In my exposition, I mentioned that by the end of the day, pandemic will be over. Of course, it's important to see how we will go through that. The issues that Mr. Jutta mentioned, we all have been discussing for many years now, have exacerbated during this pandemic, COVID-19, and therefore the current approach by the government is undertaking of regional measures, not national, because parts of the problems you mentioned, such as plant operations, etc. This is, to have regional ordinances to increase the capacity in hospitals, because there are differences in the levels of morbidity in different regions. This is why. Thank you for raising this question. But for example, in the region of Kırjali, we have the lowest number of COVID patients, 269 per 100,000. It's tenfold as much here in Sofia. So what we have commented with colleagues from information services through the National Health Information System, I will ask for statistics to see if there is correlation between these tenfold differences. Does the anti-epidemic measure compliance have anything to play, etc.? With regard to reactions in children, you're absolutely right. We have to see the long-term consequences on the psyche, not only of children. They're the most brittle part of our society. There have been such studies in Ministry of Education, what part of children after that come back after online training, and this is why the amendments that we made in the plan to cope with the fifth wave, the differences I mentioned, we left at a regional level in coordination with Ministry of Health to undertake measures and to preserve as far as possible students' forms 1 to 4. Because all these changes could affect them in terms of motivation to education at large through the years, etc. Thank you for mentioning the topic of children. Mr. Krstev also mentioned child health care. This is one of the priorities in the program of Ministry of Health, and there is a serious and deep analysis to be made, because you know that in the several months, maybe 2 or 3, very topical issue in public space has been building a children's hospital. This is by far not the most crucial topic. What is more important is what's going on with pediatric care. What is the needs? What is the vision? So we have a long-term strategy. And it's about location, about the building, about the wards, etc., about medical professionals. This has also been raised as an issue. The staff, it's not only the building, but also the medical professionals, the direction and the vision. This is why we are going to implement a thorough analysis. And the building is a function of that analysis. Mr. Krstev mentioned the Ministry of Education. It's crucial to have the needs match the admission to higher education institutions. So the ratio we need nurses to doctors be part of the admission. Another important part in the is to help us go through such issues. These are the stakeholders, and these are employers. We mentioned young professionals, but we must take care of all professionals that we need. This is good microclimate in the health facilities, equality and equity, team work, including dental care professionals, etc. Everybody involved. Maybe I exceeded my scope a bit, but the curricula in many countries, in this spirit of holistic spirit, is part of their education. So this is what I would like to see in Bulgaria too. It's not only a matter of payment, but it's also a matter of attitude, of career development. It's a matter of direction and vision. Thank you for the questions you raised. Thank you to Professor Serbezova. Do we have any other expositions? Professor Mikhailov?
Dear Mr. Chairman, Professor Serbezova is quite right. There was a certain discrepancy between what Mr. Yutte said and what we actually expected from this meeting. But I have to wholeheartedly thank Mr. Yutte for presenting very precisely the main problems of Bulgarian healthcare. They're much more serious than the COVID crisis problems. And I suppose their solution shall start with the beginning of this, the activity of this government. What you shared, Mr. Yutte, we are clear about the problems. Our political party and our coalition partners, we are clear about the hospital care that is too much, about the deficiencies in healthcare professionals that you very precisely quoted. These are issues that we have tackled in our coalition agreement. And we will start solving in the course of our mandate. But now I would like to demonstrate the COVID and the level of healthcare system in the different regions of the European Union. And since I have a long expertise as a doctor and participant in many international forums on strategic medical issues, I would say that there are different differences between the figures that you quoted. And these differences make the states to state these problems in front of the European Commission and try to find solutions. I'll quote a colleague of mine who was Minister of Health of Slovenia. At an international meeting, he shared that he cannot accept that the chances of an oncological patient survival chances are 15–20% higher to survive than an oncological person in Slovakia. Cardiology, neurology, oncology, these are strategic fields where there are décalage, as French people would say, décalage. And in this field, we as politicians, I for the first time shall mention it in front of Minister Serbezova, we need huge efforts on the side of the European Commission to tackle the topic healthcare in the whole European Union because it causes medical migration, immigration, national migration, immigration. And this actually harms to a very great extent the healthcare systems of the different countries. We've been criticizing the governing party before us, but there have been efforts have been made to increase the specialists, medical specialists. But in the last year of their studies, they signed contracts with some foreign country institution and they leave Bulgaria. So this question is very important, and it is more important than setting up regional medical centers. In this aspect, we have a task to make a unified system for specialization of all medical specialists, and we have no time. We have to give a solution to this problem and create such a system by the end of this year. We have to invite our young medical specialists to kindly invite them and motivate them to stay in Bulgaria. And I hope we will do this together with the social minister and Minister Serbezova too. I'm not going to dwell in detail, but I would like to support both what you said and what Minister Serbezova said, that the COVID pandemic was a great lesson for the whole healthcare system of Europe. This lesson should be revised very well, and all the conclusions should be made, and all the problems, all the discrepancies between the healthcare systems of the different member states should be removed, and people should feel safe in the environment they inhabit, no matter, regardless of the part of the European Union they live in. Mr. Jutta, would you like to add something from your point of view after this short presentation?
Thank you. Thank you. Yes. Let me start by saying that obviously my presentation was in a way a bird's eye view. In 15-20 minutes, one can only touch on the main points, and many things have come to the fore in the debate, including, of course, the impact of COVID. That is a problem in all member states, I believe, in terms of delayed care and important delayed care leading to very negative outcomes for individual concerned. So that is the first point to make. And clearly, member states can learn from each other's experience in this respect. And I believe this is also taking place. But I want to come in particular back to two issues. One is the financing of training, for example, of young doctors that has happened, and Mr. Krastev has referred to it, by the European Social Fund. There was a very good rule in place. We finance your training, you stay a number of years in Bulgaria. You know, it is not a free meal. You get the funding. There is a counter service to be provided. This seems an important thing to do. And I think that it can be a part of finding solutions. And it's, of course, again, just one element. Another point I want to make in terms of the issue raised, how do you manage this? How can you shift a bit away from an emphasis on hospital care? How can you keep track of delayed medical interventions and so forth? Well, clearly, the IT system behind all this, the management system, is vital, and I cannot emphasize this enough. And so, for example, how do you shift away from hospital care? It means that you want to reduce, in relative terms, the number of people that get their interventions, their support in hospital. You want to have it more in outpatient care. And this is data you can follow real time. You can have statistics every 2 or 3 months and say, how are we developing? What is the average number of days that patients stay in hospitals? Because, you can compare that, of course, to the kind of treatments that are given. And you can compare that to international standards. And you can follow this every 2 months. And over a certain period, when you have taken measures to to somehow shift a little bit the balance, you can see the impact develop over months. Or if you don't see the impact develop, you can already after half a year or 1 year say, listen, this is not maybe working as we anticipated. We need to do more, or we need to do it differently. And so this data-based policy making, where healthcare is really a domain where this can be extremely helpful. It's not the only thing. It's very much about people. People are people. They are not computers. So it's something that needs to be done with nuance. But this can be an extremely helpful tool for the ministry to make the shifts that I've been talking about. Thank you.
Thank you, Mr. Jute. Dear colleagues, Dr. Adamov, you have the floor. Dear Mr. Chair, dear Mrs. Minister, dear Deputy Ministers, dear Mr. Jute, as far as this discussion is based on healthcare after, beyond COVID crisis, it's difficult to analyze this within this session, all issues of our healthcare, no matter how hard we try. We should, however, see in what way, after the COVID crisis, we can build upon the system, upgrade the system, healthcare system, so it overcomes the issues in that system. From that perspective, I would like to congratulate the head of the Commission who invited the right people. This is not just medical or just social issue. No coincidence, no chance. A few years ago, I don't remember when, here at the Healthcare Commission, we adopted a text on the Health Act to offer medical, social, and social care, which is extremely important because solving just the medical issues or just social issues cannot address people's expectations, especially in remote areas where access to healthcare is not only limited, but is even totally missing in some parts of the country, some remote areas. So I would like to ask Deputy Minister of Labour and Social Policy, Mr. Ivan Krstev, what are the possibilities to fund from the European Social Fund and the Operational Program Development of Human Resources, these combined medical and social activities, because including involving only the ESF would hardly solve the issues we have. Why I'm saying this? Because at this stage, as far as I know, there is agreement on the next programming period. So to receive funding from the new program period, it will take some time. And the measures that have to be taken now require not only organization, not only logistics, they call for funding, as you mentioned, of sufficient various policies, not just policies related to qualification, requalification, but you also mentioned digitalization. You mentioned also the possibilities to open certain offices, practices, but we should consider how these offices, perhaps for primary care, how they will be implemented because of this shortage of medical professionals. Because no matter how much we desire this, we can have funding in infrastructure, but have nobody to work there. So my question is, let me repeat, in what way can we present this combined aspect, which is crucial for elderly people, the vulnerable people, who don't have access to medical care? And because Ministry of Labour and Social Policy has a wide network for offering social services, home and social patronage, I don't want to mention all of these services. How can they be combined with offering health care? Because This is absolutely important to address the expectations of people, to meet their expectations, because just social or medical on their own, this does not solve their problems. Therefore, I believe that there are possibilities to provide such combined services. I'm repeating this word because people expect this.
Thank you. Dr. Ademov, thank you for the question, Dr. Ademov. It is a very timely and adequate question, and we really face these problems. Your experience is huge. You know social services very well. So our measures cover a lot of people, but they do not give people all the support they need. So our program has documents. In our program documents, our and the Health Ministry include a combination between the health and social services. We are not going to be that ambitious to say that we are going to provide doctors' patronage to old people's homes. But we have several pilot projects where we provide patronage by nurses visiting the old people's homes. We have a pilot project that were supported by Switzerland in some peripheral regions of Bulgaria. So we are ready. We have a model in place. And in this model, in the distant areas, there will be telemedical services provided or telecare services, diagnosing and monitoring the health condition of patients, or not exactly patients, but for example, old people. So this model is being created. We have pilot projects. You are absolutely right that the main challenge is providing human resource to work in that field. This will be a problem. All people around this table would agree that one of the ways to overcome it is to motivate specialists, both doctors and health professionals of other kinds. We will adapt the legislation. We will work out standards for these integrated health and social services, where the salaries will be meeting the expectations of specialists who can work in that field. And about digitalization, maybe Professor Serbezova could add something, if you don't mind. Thank you, Mr. Kristof. May I add? Yes, you have the floor. Dear Mr. Chairman, ladies and gentlemen, Mr. Ademov, I would like to share with you that although the accent is on COVID-19, we are not forgetting, we're not overlooking the other services. The draft budget for 2022 includes 3.8 million for e-healthcare. They will be added to the electronic system for recipes that already exist. We will also digitalize tests, dossiers, and electronic medical services. We've got 35 electronic registers that we have envisaged, and we have increased the capital expenses for building the national healthcare system. Professor Serbezova, thank you for this information. This is the pilot project, which will give the beginning for using the digitalization in the system. I understood that you are busy, Mr. Yuta, and I would like to thank you for your participation, and I hope this is the first step to our collaboration, so I would like to give you the floor for some closing words.
Thank you so much. And let me just, before I really say goodbye, thank Dr. Adamov also for his question, which I think is quite at the center of many things. And let me underline that indeed there can be different sources of financing, but what is to be expected is that the issue he raises, the different targets and milestones, so really quantified targets, will be a part of the Recovery and Resilience Program, at least I hope so. This program that should provide 6.6 billion euro of financing, but in exchange for commitments on terms of what will we achieve with the investments, targets, and what will we do in terms of reforms, the milestones. So this is really, therefore, something where the Commission will closely monitor and follow, together with national authorities, the progress that is quarter by quarter made on those various ambitions. These ambitions, for example, in bringing also in remote areas more access to healthcare or social services. And indeed, an important part, and I'm very grateful to Mr. Krastev, an important part will be also then supported under the European Social Fund, for which he holds responsibility. And indeed, I'm very sorry, I have to run off to the airport. I wish to thank you very much for your kind invitation to be with you today. It has been my pleasure and my honor, and I'll be happy, of course, anytime that you wish to discuss matters with me. I'll be at your disposal. Thank you once again.
Thank you, Mr. Yuta, for taking part in our Healthcare Commission. Colleagues, let us go on with our agenda. Professor Hangelov, you have the floor.
Dear Mr. Chair, dear Ms. Minister, dear Deputy Ministers, dear... Okay. I believe in the field of healthcare, investment in technology and human capital after COVID-19 pandemic. Of course, when we speak on that, need the provision. Here we must say what Bulgaria's position is. And this is the question to Professor Serbezov. What is Bulgaria's view on building the European Health Union? During the last conference on the future of Europe in Strasbourg, with regard to the healthcare systems in the Union, we had 13 recommendations. Some of the more important ones were to guarantee common healthcare standards, also minimum wages, cap of hours and standards of training. Treatment in the EU be of the similar quality and a fairer price at a local level. Recommendation to set up a European database in the field of healthcare, where medical dossiers be accessible in cases of emergency or disease. Let me say that starting to build a national information system during our government should give the possibility for our healthcare system to be part of the European healthcare systems and to be connected, so that each patient on the territory of the European Union to have access to their medical records. So, recommendation to develop and synchronize existing programs for R&D, to increase the budget for joint projects in R&D, the related recommendations to identify 1 week dedicated to health with special emphasis on mental health, mental education, a good system for communication of all our initiatives on mental care, and minimum standards for dental services, shared competencies between European Union and member states, free courses for first aid to all citizens of the European Union, as these courses be mandatory for the students and workers. And of course, European Union to guarantee that the private providers of healthcare services do not take advantage by public funds in an unfair way and tap into the resources of public healthcare. All the issues that were raised here on the future of Europe in Strasbourg last week can really be solved through a common policy related to building the so-called European Healthcare Union. At the Bulgarian level, if we speak of healthcare system, we cannot, this system cannot go after fiscal targets and results related to measuring how much money we give for healthcare without taking into account the effective indicators on the quality of the system. The best indicators related to the quality of healthcare in the country are demographic indicators, and in particular, mortality and preventable mortality. What we can boast of is that during the last 10 years in our country, there has been a trend to reduce the all-cause mortality and the mortality from CV diseases as the first cause for mortality of Bulgarian population. Bulgaria, however, ranks first in the European Union in terms of mortality. It's twofold over the average for the European Union. With regard to the insufficiency of medical care specialists, last year, let me underline this, our government made a decision to announce the profession of nursing profession a priority specialty in universities, which means that all students enrolled for a specialist in healthcare will receive double the amount of scholarships, and the higher education institutions will obtain higher levels of funding. With regard to nursing care, and in particular the possibility for nurses to work outside healthcare facilities funded by the NHIF, we introduced that. We had a budget last year, but there were no registered practices of nurses who actually to start operating. And of course, I very much believe Professor Serbezova that she will not give up. Yes, I sincerely wish her luck to finalize e-health, because when we discussed with her, when she was chair of the Bulgarian Pharmaceutical Union Association, she was very much about introducing e-prescriptions. So I wish you that to be in all parts of e-health, medical records, the referrals, the prescriptions, etc. despite the resistance in the system. Of course, I cannot but touch on an issue because this is that you're here with us. There is a very big issue that currently is facing Bulgarian health facilities related to the incapacity to forecast the costs for the last 3 months related to expenditure of healthcare facilities for electricity and heating and gas. I very much would like to hear from you what measures, effective measures, is your team undertaking to compensate the healthcare facilities, and in particular the municipal ones, who have the least capacity to navigate in terms because of their small budgets. And what exactly are you going to do? Because in the budget that has been uploaded for public discussion, I don't see a policy to that end related to increasing the funds under Ordinance 3 or another type of normative act to solve this, to prevent such a forthcoming bankruptcy of municipal healthcare facilities. Thank you, and I'd be happy to hear your answers to the two questions. Thank you for that question. First, I would like to say that measures to cope with those issues come from the whole government, and in particular the Ministry of Energy, that will underlying for all experiencing such difficulties. I will leave for Professor Serbezova to air her view. Dear Chair, dear ladies and gentlemen, members of Parliament, dear Professor Angelov, really, I confirm hereby, I would say my consistent view on achieving the aims and objectives of e-health, because digitalization is not only the prescription forms and prescribing medicines to be done electronically. Digitalization is needed to have information at any given point of time with regard to the processes taking place in terms of medical activities, of release of medical products, also costs, effectiveness, because we need to know, we and the people who will come after us to govern this system of healthcare, how these investments were made, whether the first choice of treatment or procedure was the best, what cost for the society, patient, family, and whether the maximum effect was achieved. All this together with taking adequate long-term solutions in the field of healthcare cannot be done without data. We cannot manage processes without generating data. This is why we're speaking of digitalization that goes beyond the scope of e-prescriptions. With regard to measures for the hospitals, as Associate Professor Donov mentioned, this is part of a whole policy of the Ministry of Energy for non-household customers. And with regard to Ordinance 3, I believe 3 weeks ago I answered this question about that correction that has been envisaged. With regard to question about national position, these questions are very important. Connectivity between the health systems, taking into account the national specificity, of course, using e-records not only on the territory of Bulgaria, but the idea is these systems to be connected between the countries, member states, and currently such a project involves 21 member states, as 2 of them are already exchanging e-prescriptions. With regard to mental health, there will be a national council very soon set up. Very soon we will have letters to invite representatives with regard to mental health, because in recent years there have been several reports identifying some of the issues that you mentioned with regard to implementing psychiatric care in Bulgaria and measurements to support mental care and mental state, and saying that healthcare is of key national importance. This is so. But we should take advantage of the measures and the common policy of the European Union as far as it supports us in these efforts. The discussion on European Healthcare Union continues at EU Healthcare Ministers. 12 February, there will be an informal 5th to 12th in Grenoble, France, Ministers of Health, so that we coordinate the national position, and also the issues raised by the French presidency will also matter. The common policy is very important to support us while taking into account national specificities and patient being at the center, who, as we understand, is not only from Ms. Yuti, but also from discussions before that, unfortunately, is the one paying most on their own in the European Union. Thank you.
Thank you, Minister. Any other people? Dr. Simichiev, then Mr. Veselov. Thank you. Mr. Chairman, Mrs. Minister, dear colleagues and guests, I would like, within the topic we've been discussing today, since we are mentioning technologies, human resources and everything, let us try and focus on the thing that can really make a difference. And this is my personal opinion. This in the short term and regarding the resources that we have and relating digitalization. We've mentioned several times to reach digitalization, achieve digitalization as things that we can achieve. However, the world is far beyond what we call digitalization. This is not an act, this is a process. And in this relation, I can definitely say that I'm quite contented that the meeting between the E-Minister and you has taken place already. And you coordinated a number of things, because healthcare system is one of the systems that has to be integrated between, together with the other ministries, like the Ministry of the Interior, Ministry of Labor and Social Policies. Without this cooperation and integration, we cannot actually make a real change. And I hope in 6 months we'll congratulate ourselves on achieving an overall healthcare connectivity and overall connectivity. We need to reach coordination between the businesses, between the state administration, and this can be done very quickly, and it can very quickly give very positive results. This process was started by the pandemic. I personally don't believe that the pandemic will end this year. So let us try and show how much digital healthcare can contribute to solving our problems in the conditions of a pandemic. The experts and colleagues we talk with share the opinion that the real introduction of e-healthcare shall be a game changer and will give a solution to some of the existing systems for the time being. However, this is not going to be a top we're going to climb and some fame we're going to gain. It's going to be a process that will have to be developed further in the course of time. Mr. Veselov, you have the floor. Dear Mr. Chairman, dear Minister, dear Deputy Ministers, dear colleagues, I would like to shortly talk on the shortage of human resource, because in healthcare we can do anything when we have the people to do it with. And in this context, I want to mention that the problem goes back to the application enrollment of young people in the university. They're so disappointed that when applying to the university, these young people believe that they're going to work abroad. So our job is, before they start studying at the medical academy, we have to have a project in place which will inform them what they can do in order to stay at home in Bulgaria. Can you add something about this, Professor Serbezova? Yes, dear ladies and gentlemen, this is an important question. What we have as demand on the human resource side should be reflected in the enrollment at the medical universities. You mentioned that these have been priorities during your mandate. This should be taken now into consideration by the Ministry of Education, by the medical universities, so that this priority that has been set in place to be actually implemented in the way students are enrolled in the universities. I am a professor at the medical university. I'm quite aware on how students get enrolled. In the Western universities, the process is kind of reverse. We have very strict and tough entrance exams in chemistry and biology, and people get prepared for applying at a university for 2 years, and it is such a tough process to enroll in a medical university. In the West of Europe, the application process is totally different. Students are accepted at the university on a much larger scale. For example, many people are enrolled, but if you fail an exam twice, maybe you are not fit for this kind of profession. And thus the natural selection is made. So the questions you are placing are very important. No matter what young people apply for at university level, we are putting actually an accent on on healthcare, because we consider healthcare very important, because the mistakes doctors make or people working in the sphere of medicine make have really serious consequences. Yes, some majors are more important than others, but we have to take measures so that our doctors and health specialists are not drained, sorry for the expression I use, drained into the healthcare systems somewhere in other places of the world. So the attitude of the society, of the patients should be changed. Mr. Christoph, you have the floor. I would like to add something, Mr. Chairman. Dear colleagues, during the summer we organized a meeting between the three ministries, and we talked about the acceptance at the medical universities, acceptance of students. And the data was the capacity, the universities that train nurses only only have the capacity, have a double capacity to prepare nurses than the capacity actually used. So people are not interested in becoming nurses. So I would like to focus your attention on other specialists like psychologists, speech doctors. So think about whether we should not set some minimal standards for the salaries of medical specialists. So every person who's working in the field of healthcare should have a minimum salary of some kind. This is just an idea. A note by Professor Mikhailov and then Ms. Georgieva. This is kind of blitz control. These were the purposes of the meeting were different, but I would like to focus your attention on something else, and I hope you understand me correctly, as well as the Vice Minister of Labor and Social Services. Yes, the funnel of enrolling students is is upside down. It is difficult to accept a medical student in the university. People are interested in becoming doctors. I have children at home that are applying to medical university right now, and the interest among the young people is high. But what our colleague from DPC said, with the conditions for specialization that we have created are very important. We have to improve the specialization because it is a catastrophe. It is much more important than the medical education at university level. So a doctor is being trained for 4 years. And there are doctors who have never touched the patient's belly. They don't have the safe and secure environment for career development later on. It is not the tough conditions or the tough exams for accepting a medical student at the university. But the most important problems are after finishing the medical university. And this should reach the minds of the people at the health ministry. Attitudes should be changed very quickly. Thank you, Mr. Chairman. I have a question to the minister. I had a question, and Mr. Veselov asked it, and I would like to thank because I got a very good answer from both ministers. We've been talking a lot about nurses and health professionals, but we are too late. For 10 years now, we've been trying to improve the working conditions of nurses, which would help the quality of healthcare, improve the quality of healthcare. And now Bulgaria is in a medical crisis because there is no way a nurse to work in 3 places to be able to have the minimum salary doubled. She has to work in 3 working places. And everybody is sick and tired of it. And we are late. We should provide motivation for the young girls to go to a nursing school. I've been working for 23 years as a nurse. It's a wonderful profession. Working together with knowledgeable doctors is wonderful. But in the end of the day, you have no financial stimulus, you don't have the financial motivation to feel well, to feel comfortable in your life, to be able to afford a living, a decent living. And talking about the out-of-hospital care, the pre-hospital care, problems are very serious. We have to work on prevention in a very serious manner, and then take into consideration the hospital care. Thank you for the questions and thank you for the answers. Thank you, Ms. Georgieva. I think you expressed your position very well. Before we close our meeting today, I would like to thank everyone who took part in the discussion. The Healthcare Commission recognizes the challenges that it is facing. We understand that there should be a change. This change is inevitable. It has to take place. All problems were well described, well analyzed, well characterized and we being the legislative, on the legislative side, and you being on the executive side of the government, we believe that working together we'll be able to give solutions to those problems.